Psychological disorders, Part 2. First, clinically significant syndrome. When we have some physical symptoms or complaints, we know that we are ill. In the same way, in psychological disorders, there should be certain patterns of important behavioral or psychological syndrome that occurs in an individual. There are certain symptoms that occur together in a particular disorder. These clusters of symptoms together is called a syndrome. Psychologists rely on these syndromes to diagnose the disorder. We will study about these syndromes in the section where we will examine few psychological disorders. Second, distress and impairment. There should be presence of distress and / or impairment. We have already learnt about distress as well as impairment in 11th standard. Distress is the psychological pain. The pain may arise due to negative feelings like sadness, fear, inadequacy, restlessness, or irritability. It may also be due to stress. Impairment is inability or difficulty to perform appropriate duties and roles in personal, social, and work related situations. Third, dysfunction. If the symptoms lead to an underlying psychological, biological, or developmental dysfunctions, then it leads to the diagnosis of mental disorder, which is inability to remember, inability to learn, and inability to concentrate, etc. Fourth, if any response given to stressors or losses are accepted as a response to that situation, it is not considered as a sign of mental disorder. It should not be a response that is normally given to common stressors and losses, like sadness experienced at the death of a loved one is not a sign of any mental disorder, or it should not be culturally sanctioned response to a particular event, which is like trance state in certain religious rituals should not be considered as sign of mental disorder. Fifth, any behavior which is just deviant or conflicting with society but not producing dysfunction or distress or disability, then it does not become a sign of mental disorder. Behavior should not solely be a result of social or cultural deviance or conflicts with society or conflicts with political system. For example, in certain societies and cultures, homosexuality is considered as abnormal behavior. But according to DSM-5, it is not considered as a sign of disorder. In short, psychological disorder or mental illness is a condition or clinical syndrome which involves change in emotions, thinking, and behavior or combination of these, such that it leads to distress, dysfunction, and / or impairment. Before we study about various psychological disorders, let us study some important concepts and issues related to mental health. Mental wellness. Study two examples given below and decide who leads a better life than the other. Why do you feel so? Remember, in both these examples, the person described is not suffering from any psychological disorders. Activity 2. First, Karan, an 18-year-old student, got admission in one of the reputed engineering colleges. After few weeks, he starts finding engineering uninteresting and difficult. He feels doing engineering is useless and a waste of time. He keeps himself out of the classes and spends most of his time wandering around the campus. He feels his life is a waste. Second, Pramila is an 18-year-old whose father died recently. She is eldest in the family. She and her mother are extremely worried about the financial crisis that they are soon going to face. So she took up a job during daytime and joined a night college. She feels extremely tired and tensed most of the time. She is hopeful that she will soon be able to change the situation. She dreams that one day she will establish an organization that will help all the needy students in the matter of financing their higher studies. Now, study two more examples. Both the examples are stories of psychologically ill individuals. Activity third. Now decide who you find functioning better than the other in spite of illness and why. Third, Santosh is a drug addict. He has realized that his habit of taking drugs has caused him a lot of damage physically, psychologically, socially, as well as financially. Now he is determined to put an end to his habit. He failed in many of his attempts, but he is convinced that with continuous treatment he will be able to lead a normal, healthy life again and will be able to fulfill the needs of the family. Fourth, Lalita's parents are always fighting. Her father is an alcoholic and beats everyone in the family. She is extremely sad and is not able to focus on her studies. She has stopped interacting with anyone, including her friends. She feels very lonely and feels that her life is of no use to anyone. She feels her future is dark and gloomy. When asked about what she wants to do in future, she says that she has no goals in life. She feels very tired and says she is fed up with life. In the first two examples, you can see that in spite of having many difficulties, Pramila appears to be functioning better as compared to Karan, who is well placed and has fewer problems. Similarly, in later two examples, though both of them are suffering from psychological disorders, we find Santosh to be doing better than Lalita. This is because mental health or mental wellness does not necessarily mean absence of illness. Then, what is mental wellness? On the basis of the above examples, can you identify some markers of mental wellness? What are the main differences between Karan and Lalita on one side and Pramila and Santosh on the other side? Let us study what exactly is mental wellness or mental health.